Hello everyone, this is Dr. Madhusudan Rao and the program I teach medical students. The topic of today's lesson is patent ductus arteriosus, commonly called as PDA. I have already uploaded some of the lectures from cardiovascular system. For example, on the topics like fetal circulation, cyanotic and cyanotic annular heart diseases, especially tetralogy fellows, TET spells, atrial septal defect, ventricular septal defect, pulmonary stenosis, and rheumatic mitral stenosis, aortic regurgitation, etc. And an important video I have uploaded already on the auscultation of the heart, examination of the general examination of the cardiovascular system, a video on the recording of blood pressure, and a video on JVP, etc. So this topic, patent ductus arteriosus, one of the lectures from cardiovascular system. This is for the benefit of the undergraduate as well as the postgraduate students in pediatrics. Coming to the topic, patent ductus arteriosus. Ductus arteriosus is an important vascular structure in the fetal life that connects the pulmonary trunk with the descending aorta. At the proximal end, it connects to the pulmonary, common pulmonary trunk just close to the left pulmonary artery, and the aortic end of the ductus arteriosus is connected with the descending aorta around about 10 centimeters distal to the origin of left subclavian artery. Structurally, the media of the ductus arteriosus consists of spirally arranged circular muscle fibers, whereas the media of the great vessels, aorta and the pulmonary trunk, contains elastic fibers. Intima contains a large amount of mucoid substance described as the intimal bed. This we are going to, this picture shows a preterm baby having the patent ductus arteriosus, taking care in the neonatal intensive care unit. What is PDA? It is not public display of affection. It is patent ductus arteriosus. You see this picture. From the pulmonary trunk, there is a vascular structure connecting the aorta, that is ductus arteriosus. This picture shows the presence of patent ductus arteriosus connecting the pulmonary trunk with the descending aorta. And the arrow reflects the direction of blood flow from the aorta into the pulmonary trunk. Well, patent ductus arteriosus is a vascular structure that connects the descending aorta to the roof of the pulmonary trunk, close to the origin of left pulmonary artery. An important vascular structure during fetal life. Okay? It carries the oxygenated blood to the descending aorta, bypassing the lungs. Most of the pulmonary blood stunted through the ductus arteriosus to the aorta, because there is high resistance in the pulmonary vasculature, and blood flows from the pulmonary trunk through the ductus arteriosus into the low resistance descending aorta. Functional closure occurs soon after birth spontaneously, and failure to close for a few weeks after birth is abnormal. It's not going to close. Aortic end is just distal to the origin of left subclavian artery. And coming to the PDA, it is more common in girls. Girls to boys ratio is 2:1. There are certain risk factors associated with the patent ductus arteriosus. That is congenital rubella syndrome. And it is also associated with 10% of the other congenital heart diseases, because there are certain cyanotic congenital heart diseases which are ductal dependent. Well, clinically, PDA could be silent and it is small. Okay, it could be moderate or large. Well, complications do occur irrespective of the size of the patent ductus arteriosus after life, after birth. It develops from the 6th arch of the 6th aortic arch. The proximal part gives rise to common pulmonary trunk, and the distal 6th pair of the left on the left side passes at the ductus arteriosus. Its development is complete by 8th week of gestation. Okay. This picture shows the persistence of the distal part of the 6th arch as patent ductus arteriosus. Well, lungs are functionally inert. The lungs are non-functional during fetal life because they are filled with fluid. Okay, and pulmonary resistance is very high. Well, 65% of the combined ventricular output goes from the right ventricle via the ductus arteriosus into the low resistance systemic circulation, that is into the aorta. Only 5 to 10% of the blood, that is the right ventricular output, goes to the lung to supply the nutrients and oxygen to the developing lungs. Histology I mentioned already. Media of the connecting vessels, that is pulmonary and the aorta, contains the circumferentially arranged elastic fibers, whereas that of the media of the ductus arteriosus consists of spirally and circumferentially arranged smooth muscle. Okay. Intima of the ductus is thick with abundant mucoid tissue, described as intimal bed. Well, this is the patent ductus arteriosus during fetal life. This is also a diagram representing the patent ductus arteriosus, wherein the direction of the flow is from the aorta into the pulmonary trunk. So, blood flows from the aorta to the pulmonary trunk. Okay, because the aortic pressure is higher than the pulmonary pressure after birth. So, volume of flow depends upon the size and ratio of the pulmonary and the systemic vascular resistance. Okay. And in small PDAs, the pulmonary arterial pressure is normal. There is a normal right ventricular pressure and normal right atrial pressure. Okay. In large PDA, you can say there is pulmonary arterial pressure is elevated both in systole and diastole. Imagine nearly 70% of the aortic blood is shunted across the ductus arteriosus into the pulmonary trunk. Okay, so there is flooding of the pulmonary circulation with this shunted blood from the aorta into the pulmonary trunk. Because sudden high volume runoff from the aorta result in high pulse pressure. Coming to the clinical manifestations. Small PDAs are usually asymptomatic. So there is normal heart size. Okay. Large PDA presents with heart failure in infancy, associated with growth failure, bounding peripheral pulsations, okay, cardiomegaly, forcible apical impulse, and you can appreciate the systolic thrill at the pulmonary area. When auscultate, there's a continuous murmur, peak at the end of the systole. Okay. And the aqueous systole has the diastolic phase, but intensity of the murmur is maximum at around the second heart sound. In large PDA, you can appreciate mid-diastolic murmur at the mitral area because of the large shunt and the increased venous return into the left atrium. That results in the presence of mid-diastolic murmur at the mitral area. Presence of mid-diastolic murmur at the mitral area is not associated with the pre-systolic accentuation. It is a flow murmur because of the large volume of blood that is received by the left atrium from the pulmonary circulation. Okay? This presence of this murmur is significant in the sense it denotes pulmonary systemic flow ratios more than 2:1. Okay? Coming to the diagnosis. And in the light of the clinical features, and take the X-ray chest, it shows the cardiomegaly, pulmonary congestion, and dilatation of the pulmonary trunk, and dilatation of the left atrium and the left ventricle. 2D echo shows the chamber dilatation, and there is a Doppler showing the flow of blood from the aorta into the pulmonary trunk. ECG reflects the presence of left ventricular hypertrophy or left ventricular dilatation. With the onset of pulmonary arterial hypertension, there is potentials are increased even in the right chest leads. Cardiac catheterization is generally not required for the diagnosis of PDA. And once it is contemplated, once you are contemplating the ligation of the ductus transcatheterally, then you can do the cardiac catheterization. Prognosis and complications. With small PAD, you can expect normal lifespan, but there could be late signs of congestive heart failure even with small PDA because of the early onset of pulmonary arterial hypertension. Heart failure occurs in infancy itself with large PDA. Spontaneous closure after infancy is very rare. And there is a problem of infective endocarditis, embolic manifestations, and development of pulmonary vascular disease, representing as Eisenmenger syndrome. Okay. The treatment. Treatment includes medical, surgical, and treatment in preterm babies. This is the baby in the neonatal intensive care with patent ductus arteriosus. This picture shows the transcatheter insertion of the coils into the patent ductus arteriosus. Well, this is in brief about the patent ductus arteriosus and its clinical features and management. Thank you very much for patient listening. And if you like my video, please subscribe to my channel and mention like to encourage to send in some more videos for the benefit of my students. Then we will continue the lectures in cardiovascular system. Probably we have uploaded adequate number of videos in the cardiovascular system. If at all, if I do it, I may talk about the lecture on infective endocarditis, that is subacute bacterial endocarditis, in the coming class. Thank you very much once again. We will meet you in the next class. Until that time, bye-bye.